The vagina is a part of the female reproductive system, playing a key role in sexual intercourse, childbirth, and menstruation. It is one of the internal genital organs and is essential for both healthy living and reproductive health. Often, the vagina is confused with the vulva, but in fact, the vagina is a tube-like organ located inside the body. It's important to understand the differences between the vagina and the vulva, as many people mistakenly refer to the vulva when they mean the vagina. The vulva encompasses the outer part of the female genital organs, while the vagina represents the internal part. Understanding this difference helps in correctly understanding female anatomy. The vagina is capable of sending signals about the body's health, and it also plays a vital role in fertility. Processes like menstruation, sexual intercourse, and infections can send signals through the vagina. For example, when the vagina is healthy, there are clear signs that can indicate this. Understanding these signals can help detect health issues early. The vagina can also signal diseases, such as fungal infections, urinary tract infections, or sexually transmitted diseases, which can cause changes in its structure. These changes often serve as signals to the body, alerting it to potential problems. The clitoris is an organ filled with nerve endings that enhance sexual pleasure. It plays an important role in female sexual arousal, and due to its sensitive structure, can be a significant source of pleasure. The clitoris is one of the most sensitive areas of the body, with thousands of nerve endings located there. The vagina is flexible and capable of expanding. This flexibility allows for a more comfortable experience during sexual intercourse. Moreover, during childbirth, the vagina undergoes significant expansion, but it generally returns to its normal state afterward. Many people believe that childbirth will permanently change the shape of the vagina, but it usually returns to its pre-birth condition. While the vagina may expand during childbirth, it typically reverts to its original state afterward, with no permanent alterations in sexual function. Postpartum sexual life can be a concern for some women. Although vaginal muscles may stretch during birth, they gradually return to their normal state. If discomfort is felt during intercourse, this typically resolves over time. The hymen is a thin membrane around the vaginal opening, often associated with virginity. However, there is a misconception that it ruptures during sexual intercourse. The hymen is not a sign of sexual history. It is simply an anatomical feature that is present at birth. The vagina does not open into the abdominal cavity. Anatomically, it is only connected to pelvic organs. The vagina is not linked to the abdominal cavity, and understanding this can help clear up misconceptions about female anatomy. The vagina is highly flexible, allowing it to expand during sexual intercourse to facilitate a more comfortable experience. Just like a sock, the vagina can adjust its shape when necessary, but this expansion is temporary and does not cause permanent changes. Many believe that something can be lost inside the vagina, but this is not anatomically possible. The vagina is always structured in a way that conforms to the body's needs, and there is no situation where an object could be permanently lost inside it. The shape of the vagina varies from woman to woman. The size, length, and structure of the vagina differ between individuals. This diversity reflects the uniqueness of each woman's body and the fact that everyone has a healthy and functioning body. The shape of the vagina is not an indication of any health problem or abnormality. Vaginal hair is a natural feature that helps protect the body. This hair assists in guarding against infections and maintaining hygiene. While trimming vaginal hair is not harmful, it's important to remember that it serves a natural function. The habit of trimming vaginal hair varies based on personal preferences and age. Some women prefer to trim or remove hair from the vaginal area, while others do not. Hair removal habits are entirely personal and can change over time. There is a common belief that using condoms reduces sexual pleasure, but condoms do not have a negative impact on sexual experience. Condoms are an essential part of sexual health, providing protection against sexually transmitted diseases. Rather than diminishing pleasure, they enhance safety. The vagina and vulva can vary greatly in shape and size. Every woman has a different anatomical structure, and this variety is completely natural. The diverse appearances of the vagina and vulva reflect the unique anatomy of each woman, The clitoris and the G-spot are two important areas that enhance sexual pleasure in women. The clitoris, which is located externally, is a highly sensitive organ filled with thousands of nerve endings, while the G-spot is located inside the vagina and can be an intense source of pleasure for some women. These two areas serve different functions in sexual pleasure. The G-spot is located on the front wall of the vagina and can be a significant source of pleasure for some women. However, not all women experience intense sensations from this area, and the G-spot's presence and effect can vary. For some, this spot may be more or less pronounced. Women may experience orgasm less frequently than men during sexual activity, and this is completely normal. Every woman's sexual pleasure differs, and orgasm experiences can vary. What's most important is mutual understanding and comfort in sexual relationships. Female orgasm is not solely a woman's responsibility. The partner is also responsible for contributing to sexual satisfaction. A healthy sexual relationship is based on mutual understanding and communication. Partners who listen to each other can improve sexual satisfaction for both. The idea that women ejaculate during orgasm is largely a myth, often propagated by pornography. Most women do not experience this phenomenon. It's important not to fall for these myths and to approach sexual health with a realistic perspective. Sex is not just a pleasurable experience, but also beneficial for physical and psychological health. Sexual intercourse boosts the immune system, reduces stress, and improves mood. Regular sex is advantageous for overall health. It's normal for some women to feel the urge to urinate during sex. This sensation may arise due to the proximity of the vagina and urinary tract. Feeling this urge during intercourse is not unhealthy and generally shouldn't be a cause for concern. Using condoms is an effective way to prevent sexually transmitted infections, but no method of protection is 100% foolproof. While condoms offer significant protection during intercourse, some diseases can still spread through skin-to-skin contact. Proper protection is key. Birth control pills can affect vaginal lubrication. Some women experience vaginal dryness while using birth control pills. This can often be relieved with lubricants, or alternative birth control options can be explored by consulting a doctor. Every woman's needs are different, so choosing the right option is important. Implants and intrauterine devices, IUDs, are birth control options for women. These methods regulate hormones and prevent pregnancy. There are different birth control options available, and it's important to choose the one that suits each woman's needs. Lubricants enhance comfort during sex and can make the experience more pleasurable. They also help solve problems like vaginal dryness. Using lubricants is an effective way to increase sexual satisfaction. Pain during sex is typically a sign that something is wrong. If pain occurs, it usually indicates a health issue, and it's important to consult a doctor. Comfort during sex is crucial for a healthy and enjoyable experience. There is no normal amount of discharge during menstruation. It varies for each woman. However, menstrual discharge generally increases in volume during periods, which is completely natural. Every woman's cycle is different, so it's important to know your own body. Lesbian women may experience orgasm more frequently than heterosexual couples. However, every sexual experience is unique, and each woman's pleasure varies. Orgasm is not something every woman experiences, but mutual understanding and comfort are key. Vaginal douching can disrupt the natural balance of the body and may be harmful. It is advised to avoid vaginal douching. The body has its own mechanisms for cleaning itself, and these should not be interfered with. Paying attention to fungal infections is important for maintaining vaginal health. Fungal infections can cause discomfort and, if untreated, lead to serious issues. If you suspect an infection, it's essential to see a doctor right away. Thank you for watching the video. Don't forget to subscribe to our channel for more accurate information about health.